Welcome and thank you for joining us for today's information session, Psychosocial Grants for 2024. My name is Sydney Cruikshank and I'm from the PHN Education team. I'm joined today by my colleagues Melissa Collins and Scott Wood. Before we begin, I'd like to acknowledge the traditional custodians of the lands that we are all meeting on today. For myself from the Central Coast, that is Darkinjung country, and I'd also like to pay respect to all elders past, present, and emerging. Now, a few things to let you know about this session. It will be recorded and available for you to view on our PHN Education Library, as well as on the Psychosocial Grants landing page on our website. Now, as attendees, your camera and microphone are automatically disabled. However, if you have any questions throughout this session, there is a question box that you will find located at the top of your control panel. At the end of the session, we will go through any questions that come through. And at the end of the session, an evaluation will come to you directly after, which we will ask that you kindly answer for us to get some feedback on this session. Now, it is my great pleasure to hand over to Melissa Collins.
Thank you so much, Sydney. Welcome everyone, and thank you for joining us today. I would also like to acknowledge the traditional custodians of the lands that we're meeting on today. I'm very fortunate to be here on beautiful Darkinjung land, also on the Central Coast. I would like to pay my respects to elders past, present and emerging, and also acknowledge the work that the PHN and many of us on this call do today to support better health outcomes for First Nations communities. As Sydney said, we're here today to provide some further information about our psychosocial grant round. My role at the PHN is Grants Manager, so I will be taking you through some further information about this grant round, along with my colleague Scott Wood, who is our Commissioning Coordinator for Wellbeing. So thank you once again, everyone, for joining. Next slide, Sydney. So today we're going to cover off, first of all, a little bit about the Hunter New England Central Coast Primary Health Network. We do have some new faces in the meeting today, so it's a great opportunity to give you a high-level overview of our organisation. We will talk also around psychosocial approaches and mental health, and then provide a little bit more specific information around our guidelines and process. And as Sydney said, certainly have some time for questions and answers. Those questions that we may not be able to answer today, we will take on notice and provide a frequently asked questions sheet on our website. I'm not anticipating we'll take the full hour, but it's, we certainly have the time available if required. So next slide, thanks, Sydney. So I always find it useful to go a quick overview around what is primary care. So primary care obviously is the healthcare people seek outside of the hospital system, and this could be general practice through allied health professionals, pharmacies, and a whole range of other health providers in the community. And it allows patients to receive the right care at the right time, and it's critical to a healthy population across our region. Next slide, thanks, Sydney. So there may be some people on the call today who are not as familiar with the Primary Health Network. So the Hunter New England Central Coast Primary Health Network is one of 31 primary health networks that was set up by the Department of Health and Aged Care. We all operate as independent, not-for-profit organisations with DGR1 status, and our particular primary health network, our region is quite vast, and it covers from the Central Coast right up to the Queensland border, out west to the Moree Plains and the New England region, and we cover over 23 local government areas with approximately 1.5 million population. We've just recently had a new strategic plan released, and our strategic purpose is to increase equity of access to primary care across our region. So in a practical sense, what that means is we commission and fund a range of health services and supports, including mental health, services, drug and alcohol, First Nations health. We support general practice, older persons program, rural health. We also fund and commission the after hours and urgent care clinics. And increasingly, we also now have a focus on domestic and family violence, homelessness programs, and culturally and linguistically diverse health programs. So, everything with a health focus that you might find outside of the health system, hospital system, yet at the same time, we certainly work hand in hand with our local health district partners. So, whilst we're predominantly a commissioning organisation to distribute funding from the Department of Health and Aged Care, we do also have the flexibility to explore innovative solutions to health issues, which is where this grant round is coming in. Next slide, thanks, Sydney. And just to reiterate, so the primary purpose of the Hunter New England Central Coast Primary Health Network is to increase equity of access to primary care. So that means identifying needs across our region and removing barriers so our communities can access the primary care that they need when they need it. Thanks, Sydney. So why are we focusing on mental health for this particular round? Well, ABS statistics recently released this year indicates that almost half of our population will experience a mental health disorder in their lifetime. So it is incredibly important for us as a primary health network to ensure that we are providing appropriate support to our communities. Thanks, Sydney. And why are we looking at psychosocial approaches? Well, we know and we recognise that not everyone in our community requires intensive clinically based mental health services. The spectrum of supports needed to support people with mental health concerns is wide and varied. And for this particular grant round, we are focusing on psychosocial approaches. Often non-clinical supports can provide enormous benefits to individuals and communities. So that includes participation in social connectedness, civic connectedness, and they can play an important role and positive role in promoting wellness and positive mental health outcomes. Next slide, thanks, Sydney. So essentially, psychosocial supports are non-clinical community-based supports that aim to facilitate recovery through a range of activities or services, helping people manage daily activities, rebuild and maintain connections, and build social skills and resilience. Next slide, thanks, Sydney. So a little bit more about this particular grant round. So these are our psychosocial grants. We have $1 million of funding available for this particular exercise, and that will be distributed across 2 tiers. Again, all activities definitely need to be focused in on the Hunter New England Central Coast region. And this particular grant round is closing on the 31st of May at 5 p.m. Thanks, Sydney. Next slide. So the objectives of this particular grant round is promoting mental wellness through awareness and prevention. We are looking for activities that may reduce stigma and discrimination. Definitely programs or projects that support recovery and social inclusion. As I mentioned, we're very much focused on non-clinical services or programs. And as always, the PHN has a really keen interest in projects that focus on our priority populations. And our priority populations can be characterised or identified as First Nations communities, people living with disabilities, culturally and linguistically diverse communities, older people, children and youth, and of course, people living in rural and remote regions. Next slide, thanks, Sydney. So with this particular grant exercise, we have two tiers. So the first and largest tier are for projects or programs that are between $100 and $200,000. Noting all PHN funding is GST exclusive, and tier two is 50,000 to 100,000. We have a total grant pool of $1 million. We anticipate projects commencing late June, early July, and should be completed by the 30th of June next year if possible. Thanks, Sydney. So a bit more specifically, we're looking for projects with significant impact and or reach, and really this is reflecting the size of the grant funding that is available. We're looking for evidence-based, so example, where there is evidence that an approach supports mental wellness. For example, exercise is a very well-known intervention that can help promote wellness and mental health. And we're looking for innovative solutions where possible. So something that's new or a bit different would certainly be welcome. Next slide, please, Sydney. So a few other details that will be important to consider. Successful applicants will be required to provide some form of evaluation or reporting around the impact of their projects, and may be requested to contribute to a shared collaboration forum at the completion of the activities. We're really keen as the Primary Health Network to be able to share learnings, success and challenges that might have happened with different projects across our region, so that the impacts and the learnings are certainly amplified across the region. The projects will need to demonstrate impact and links within our region and partnerships if required. Next slide, please, Sydney. So organisations will need to have an ABN, and if partnering, there'll need to be one lead organisation. We have a list of usual items that cannot be funded, and you'll find all that more detailed information in our guidelines. And that, for example, is major capital purchases, real estate, overseas travel, a few of those things that are normally excluded. With this particular grant round, we anticipate decision dates will be in and around mid-June, and we will hope to complete the assessments as soon as possible after closing date and get back to everyone as quickly as we can. Applications for these grants are available through our grants page on the Primary Health Network or the PHN website. And it is through our grants portal, Smarty Grants, that applications are required to be completed. Next slide, please, Sydney. So that's the sort of high-level overview. We'll go to questions shortly. If there are questions that come to you that we haven't actually covered, or you might think of them later, please do reach out to us also at grants@thephn.com.au, so we can answer those for you as well. Scott, was there anything in particular that I hadn't covered off in regards to psychosocial approaches that you'd like to reinforce for everyone on the call today?
No, Mel. Welcome everybody, and I think you've covered that off quite well, Mel. So yeah, in a nutshell, we're kind of after psychosocial programs that help the communities and well-being have a fair, good reach, and some degree of innovation is looked upon favourably that targets our in-need communities, as outlined by Mel before. So no, nothing extra to add there, but I'm happy for questions too.
Perfect. Thanks, Scott.
Brilliant. Well, I'll go through the questions that are received and we'll do our best to answer them. Obviously, depending on the content, they may not be able to be answered, but we'll do the best we can. So we had one come through saying, I have an idea designed for rural, regional, and remote Australians. I also live in Sydney. Would I be eligible to apply?
Certainly, you will be eligible to apply. What we would ask for in those cases, we will need strong evidence that the people of the Hunter New England Central Coast region will be the beneficiaries of that project or approach. And what would be very useful will certainly be any partnerships you might be able to demonstrate within our region, linkages, that you do have connections with the community or the cohort of people that you are looking to support.
Um, Going off that last one as well, there's another one similar. Do providers need to be based within the Hunter New England Central Coast, or can it be facilitated online?
We certainly will be open to digital solutions as well, given that access to primary care is certainly one of the major issues faced in our region. We are certainly open to digital supports and approaches. Again, we will just need confirmation and evidence that the people within Hunter New England Central Coast region, as defined, if you go onto our website, you will see a link to our region. So you'll need to be able to demonstrate that residents in those particular areas will be the beneficiaries of the project.
Perfect. Next one. To maximize impact and reach, will the PHN be happy to collaborate in sharing links/contacts, e.g., psychology clinics/GP clinics emails to promote awareness and success of the program, pending successful grant application, that is?
Certainly, the PHN part of our role is to promote projects and approaches. That will be certainly on a case-by-case basis, just depending on what the particular support is required. We would work through that with any successful applicants. So yes.
Perfect. Does the grant money include costs for marketing?
It is up to individual applicants to put forward a budget that they believe covers off on what would need to be a successful implementation. And if marketing and engagement is one of those activities, that would certainly be allowable. But it needs to relate to the particular project or approach to be eligible for the grant funding.
Can an organization submit multiple applications?
Yes, we will be accepting multiple applications. Probably would ask to consider what you are putting in. Multiple applications certainly doesn't mean you'll receive multiple grants. And we'd like to see really well developed and well thought out submissions rather than a lot of them. So yeah, just please keep that in mind as you're working through your processes.
Thank you for the presentation. It sounds as though an ABN is the main organizational status required. Does this mean that a university could be lead applicant in partnership with a few local not-for-profits?
Absolutely. We would welcome partnerships.
Sorry, there's so many. I'm like having to go back and forth. Yeah, there's lots to come, so stay tuned. Is my organization eligible given that we are not a primary healthcare provider? We are not profit supporting people with epilepsy through registered nurse support.
Um, I would prefer not to answer very specific eligibility questions. If there is in that case for that question, if that person could email us at grants@thephn.com.au, that would be good. We can provide advice.
Perfect. A two-part question. With this grant, does participation in alternate grants preclude participation in this grant?
No, but what we will consider is if organisations have been provided grant funding previously and have failed to provide sufficient reporting to the PHN on those grants, that will be taken into consideration, but if you are a current recipient of a PHN grant, that will not preclude you from applying for these.
And part two, if there is a connected opportunity, can the work proposed within two grants be combined?
Yeah, potentially. Yep, so long as that's well explained and we understand what the proposal is, yep, that would be considered.
Um, Perfect. Next one, does the target group need to be at risk of mental health issues, or is it okay to implement a preventative psychosocial intervention program that supports well-being, i.e. cultural connectedness program for regional Aboriginal Torres Strait Islander youth?
Yeah, I think as we've tried to express throughout the presentation, these are definitely not clinical services. So, activities that promote wellness and connection is what we're after. So I would say yes.
Can the funding be utilized alongside other government programs / funding grants?
There's no exclusion for that, but of course we certainly will consider, what funding is already being attributed to that type of program. So there's no exclusion, but we're certainly not. We'd be looking at, what other sources of funding are being contributed.
Is there a map defining the Hunter New England Central Coast boundaries, please?
There certainly is. If you go to our grants page, you'll see a PHN region link that will provide you with a overview of our region.
Is there a preference for locally based organizations? I think that's kind of touching on what we've been talking about a little bit.
Mm-hmm.
Next one. Can you please define reach a bit more? How many people would you like to reach with any one program? And can we look at multiple locations?
I won't define reach as such. I think it's up to individual applicants to look at the size of the grants, the funding available, and what they can achieve. And if that is multi-site coverage, certainly that would be, considered. So, we do look for value for money with any grant funding through the PHN. So we are certainly looking for reach and impact.
I would like to include a component of research of the impacts of our project undertaken by the University of Newcastle. Is this acceptable to be included in this grant?
Yeah, we are quite interested in evaluation and reporting and research. So, again, looking at the size of the grants and the activities, put forward the particular budget that the, that you feel covers off.
If one has applied for the Game Changer grant, can another application be put forward to this grant? And second to that, can you please confirm when Game Changer success will be released?
Certainly, if you have applied for Game Changer grants, you can put forward for these particular grants as well. And in regards to the Game Changer assessment, all I can say is we are working through the assessment process. There was an overwhelming, quite a large number of applications, so we're working as quickly as we can to come to you. So um, as soon as possible would be my answer there. Sorry.
If a project is part funded by the federal government, could we seek PHN funding just for the delivery to people in the Hunter, New England, and Central Coast region?
Yeah, as mentioned before, we would consider, what is already being funded, what sources, and evaluate each on a case by case basis.
Yeah. My question is the challenges for organizations who may have some wonderful ideas, etc., but need to establish programs and or projects and realistically can take 6+ months. I'm wondering how we can make this work with a 12-month grant with no recurrent funding.
Yeah, so important to understand this is not recurrent funding. It is, directed at programs that can be implemented, within that 12 months, within reason. We're certainly wanting to get impact and services into the community as soon as possible. So I understand that there are challenges in around implementation, and certainly acknowledge, often you will have that 3 to 6 months implementation. So I guess I just encourage everyone to have a look at what they're submitting to see what is realistic, and put forward your ideas, and we can work through them on a case by case basis. However, it's not recurrent funding, and we would like projects to be, within that 12-month timeframe where possible.
Perfect. Could it include a scoping study with a plan to implement the outcomes/findings?
Potentially, no. We are definitely looking at more service provision. We're not wanting this to be a pure, scoping exercise or research, or, we want the implementation to be happening. We want the funding into the community to provide these supports that are much needed, as indicated by, the ABS stats out earlier this year.
Can you please define a well thought out and developed submission, i.e. the length?
There are a range of questions on the application form, and it will be up to each individual applicant to answer those in the best way that they feel represents their organisation and their project. The only other thing I can add to that is the PHN shortly, in the next month or so, will be providing an online how to write a great submission for grants and tenders. So please keep subscribed to our Primary Health Update weekly newsletter, and you'll see some links into those workshops and resources that will be coming soon, and they will be free for anyone to access. We can't provide individual advice on individual applications. It's certainly up to each organisation to put forward their, what they feel is their best submission.
Yeah, that's really good to know that those resources will be available soon. That's great.
Yep.
Does the organization need to be accredited?
I'm not sure what accreditation you may be referring to, but as we said, the main criteria is you will need an ABN, but you will definitely need to demonstrate, that you have the expertise, ability, capacity to deliver what you're putting forward. We certainly do our due diligence with any successful organisation or anyone that we are considering. So if there's appropriate accreditations that are required, we will certainly be looking for those.
What sort of post-activity reporting is required?
Given there'll be different requirements for the different tiers, so obviously we work with an approach that the larger the project, the more detailed reporting we would require. It will definitely be for some of the larger projects. There may even be multiple, midway reports and progress reports required. And as I mentioned at the start of the presentation, it is likely that we will be requesting some form of participation in a collaboration type forum. So we can hear all about the projects, their successes, any challenges, and the impacts that they had across the region.
Yeah, fantastic. What are the factors that differentiate Tier 1 and Tier 2? And also, just a side note that this is brilliant help.
Thank you. The difference between Tier 1 and Tier 2 is obviously the funding amount. So again, it's looking at your reach, your impact, what you're proposing. The larger projects we are envisaging will likely be on a larger scale, perhaps, or across more regions, or more LGAs. Sorry. Perhaps there are more participants, or the program is more intense for that number of participants. So there's no other criteria that is different, except for it's really scale and impact of the project. For example, you know, if you're running a project, you might do it across 5 different LGAs over a period of 6 months or something, for tier one. And a smaller example, might be just one locality across 6 months or something like that. So, we've left it broad intentionally because we're really interested to see what ideas are out there.
Can the PHN put local providers in contact with those that wish to collaborate from outside the PHN's remit area, i.e. in Sydney?
We haven't made that, we haven't made that approach available for this particular one. We expect organisations to do their own, partnership seeking and engagement into the region for this particular exercise.
You may have already covered this one, but just in case, is there a criteria differentiation between the two tiers of funding?
I think I just covered that actually. Yep.
Next one. Although our program is non-clinical, the activities will be delivered by psychologists. Is that okay?
Again, not wanting to specify too much on individual approaches, but in a general sense, yes, of course, that would be fine, so long as it's a psychosocial, non-clinical type approach. Yeah.
How do you prove sustainability if it is a one-year project of funding?
Yeah, I mean that's always a great question and something we all look to. It's again up to individual organisations on how they would like to answer those questions. Again, I can only reiterate it is a 1-year funding opportunity. Often people will use this type of funding to pilot a program, to evaluate, gather evidence to then enable them to apply for other funding, that type of thing. So yeah, it's something that everyone needs to consider in their own individual projects and organisations.
Next one, which we have covered, but we'll touch on it again. Can this presentation be shared or linked to the website? So we have recorded this session. It will be available on the PHN education section, as well as, I'll just pop it up. This is the psychosocial grants page. We will have the copy of the recording and the PDF on here, as well as it'll tell you everything on how to apply, the guidelines, so you can go through that as well. And then the recording as well will be up. And then if there were any individualized questions that were a bit more specific, there is the grants at the phn.com.au. So I think I did one for you, Mel. There you go. Would this be open to those that have been released from prison?
Yeah, there's no exclusion around that particular population.
Perfect. I think it said like QUIP. I'm not sure. QUIP.
Sorry, what was that, Sydney?
In relation to the last one, so would this be open to those that have been released from prison like QUIP? I'm not sure what QUIP is personally.
Neither am I. So if that is a question that needs specific response, if they could email grants at the
Yeah, perfect.
phn.com.au.
We'll get back to you. So if that individual could just email through, that would be lovely. Can a for-profit company apply for this grant?
Yes.
Can you share some examples of successful grants?
I'm not really sure that this would be the forum to do that. People are welcome to go to our website, thephn.com.au, and go through our news section. There's always lots of really good news stories about different programs, activities, or grant rounds that we've had.
The application does not have a question around reach.
That would come through in your description of your activity. So who you're looking to support and where and when and how.
Perfect. I think that you've just answered the next one. It said, where should impact and reach be entered?
Yeah.
Perfect. Any other questions from anyone? I'm just going to have a quick look because I know that I did see hands up, but I think everyone did find the question box because we can't call on you individually. Another one's come through. Give me one sec. Thank you for this. If there are no more questions, we will wrap it up for today. So the recording will be available on the website as well. You have the email address. Now another question's just come through, which keep them coming if there are more, please. Do the target group need to be at risk of mental health issues, or is it okay to implement a preventative psychosocial intervention program that supports well-being? IG or EG, excuse me, cultural connectedness program for, I feel like we've already asked that one, for
Yeah, we
regional,
have. Yeah.
yeah. Um,
Yep. And the answer is yes. We certainly be looking for projects like that.
Yep, sorry, I didn't finish saying that. Aboriginal Torres Strait Islander. I should have finished the sentence. I think that was one of the first questions through that was very similar. I think that is everything. Looking forward to receiving all of these applications.
Thank you very
More to come
much.
through email. And Scott.
Thanks, Sydney.
Perfect, guys. Well, we'll end it
Thanks,
here for
Sydney.
today, and we'll see you at a future session. Thanks for your help.
Thank you.